So today, we welcome Lindsey. You will talk about collaborating with patient advocacy group. Please.
Melinda Bikini was supposed to speak today, and she was ill and not able to come. She's just heartsick not to be here. But she asked me if I would just share a few slides with you about advocacy. I first just want to say thank you to Patty. So beautiful. And there are just so many wonderful people to be associated with working in a nonprofit. I'm so grateful. I wanted to just share with you a little bit about what we do in advocacy. Sorry, I'm trying to compose myself, Patty. I was a caregiver for my brother, who was 38 when he was diagnosed with cholangiocarcinoma. That was about 13 years ago. Before he died, he wanted to start a foundation because he knew how hard it was for us to try and find correct information. Whoops, back. Okay. So I wanted to share with you what advocacy is. And advocacy can be many things depending on what the needs of the patients are. And that's one of the gaps that we try to fill in advocacy. So this is often what happens, right? You're giving them these words. They have no idea what you're saying. Even though they can hear it and they're writing it down, they're confused. They need some help interpreting what's happening to them. So we provide information to help them. You know, we tell them how to say the name of what they have. We give them a terminology chart and help them understand what kind of disease they have. We provide them with a community and provide them with clear communication. And we do that through a lot of different ways. Social media is one of the biggest ways that we connect with the patients. Facebook, Twitter, Instagram. Twitter is mostly where we find the medical community. That's how we communicate with the medical community, and LinkedIn. And then Facebook is where most of the patients are. And they have very, very active, private, specific groups that they are involved in. The discussion board was founded in 2007. You can see there's, 85,000 replies on there. It's deep knowledge that's in there. A lot of that information, all of the publications in there, and there was a lot of discussion in there, and this is where patients can go to get a lot of help other than if they're not social media savvy. Cholangiocarcinoma. Patty is a member of the board of directors, and she runs a program called Cholangiocarcinoma. It was conceived by a patient, a young father, whose wife died. They had a 1-year-old child, and he was trying to reach out to find another single father like himself that he could talk to about this disease. He couldn't find anyone on any of the big kind of connection mentor sites. And so he asked us if we would start this program, Cholangiocarcinoma. So it's been a little over a year, and to date we have matched more than 150 patients with a mentor that they can talk to that can help them through this disease. The annual conference is another way. It's kind of the hub of what we do. We do 2 conferences a year. We do the annual conference in Salt Lake City, and then we do the Asian Pacific Conference. So you can see here, I think this was, I can point here. This was really, really interesting to us. We do a live stream on the patient day, which is on Wednesday. We had about 1,600 on that live stream. And I heard from John Bridgewater that a lot of the UK patients couldn't get on. So we didn't actually know that we'd had some trouble. So we think the numbers would probably be higher than that. There's a lot of patients who are really wanting to get information and be educated about the disease. We provide patient-focused materials, and the biliary emergency card right here, it's very similar to the cardiology card that you saw. This was the brainchild of Renuka Iyer, who helped us do this about 3 years ago. The patient can go in, they can fill in their information. The medical advisory board put exactly what they're looking for. Their fever goes up a little bit, all those kinds of things. And these are the things that happen on the weekend when they can't get a hold of you. So their information is all on that card. They can take that in, and if they have to go to the emergency room and they're out of their treating institution, they can just present that card. It tells the treating physicians in the emergency room who may never have seen a stent exactly what needs to be done and how they need to be treated. You saw the terminology chart. This is another chart here that just kind of gives them the facts. They're just interested, and one of the first things the patients always ask is, are my children at risk? They always think there's some sort of genetic component. So we have the possible risk factors, the symptoms, the numbers, all of those kinds of things in there. And then we have, there's a Cholangio ID app that Boston Scientific put together for us. We have a lot of opportunities for them to assist in research through the patient registry, through patient surveys, through simplified clinical trials. We give industry the opportunity to work with the research advocates to do to put together inclusion or exclusion criteria and a small abstract that the patients can actually understand. It's very difficult for patients to go into clinicaltrials.gov and try to understand the options that are available to them there. So how can you better interface with advocacy? Well, you can send the patients to the website. You can, we have a lot of free literature. We're happy to send you anything for your institutions that you want to use, that you want to pass out to patients. There's wristbands and bracelets. They can participate in surveys. You can participate in surveys that we send out. We have regional symposiums. We've had a couple this year. We had one at WashU, which was fantastic. We had about 50 patients attend. Their entire GI group came. They brought in Dr. Roca spoke. It was a very vibrant group. It's very difficult for the patients, I think, especially in the Salt Lake City conference has become quite big. It's hard for them to get up and ask questions sometimes. Some are more able to do that than others. But in these small regional symposiums where these GI groups are coming together, this was a lot of discussion going on. There are a lot of patient questions. It's just I think a smaller forum where they can really get their questions answered. Collaborate with major cancer centers. And in the U.S., that's especially important. A lot of the patients are seen in these local regional centers where there are not, NGS testing is not happening. They're not getting the profiling done. They're not being seen by a tumor board, and they don't have access to a lot of clinical trials. It's really important that the patients be seen in a major cancer center so that they can look at all the options that are available to them. Again, sending the patients for genomic profiling from the beginning, regardless of if they're a surgical candidate or not. We need to get this information so that next steps they're ready to take next steps when they have progression. I would say another thing that's really important is that you, within your institutions, your GI groups are meeting regularly. How are we going to get biorepositories if the surgeons and the oncologists aren't talking and working together? How are we going to get big data from these? We've got to work together, and so it's really important that you're regularly meeting with your GI groups. I think Patty expressed beautifully to just communicate frankly and openly but kindly with these patients. And also, I think another thing would be to think outside the box. Dr. Cleary talked about how there's a lot of decisions that you are making that aren't data-based because we just don't have the data. Think outside the box. These patients are looking for solutions, and we need new, fresh ideas. We need new thoughts on ways to run clinical trials. If you came to the conference, you saw Helen and Scott. Here's a patient here who talked about repurposing drugs and some of the work that she's doing. These patients are amazing. They're doing all kinds of things outside of their levels of comfort, and I think they would like you to do the same. They'd like you to work together and think about new and innovative ways that we can work together. So where advocacy is going in the future, for Cholangiocarcinoma Foundation, we're going to be increasing our patient registry is about 4 or 5 years old. So it's being updated right now. We're including PROs in the database so that you can have patient-reported outcome data. We're working on some big data initiatives, and we're hopeful that those are going to come to fruition within the next year. For the basic research, we're going to continue and expand our fellowship awards. We want to provide resources for the global cholangiocarcinoma community, whether that's more cell lines, more PDX models, more organoids, all of those things in the public space so they are accessible to everyone. in the clinical research, Dr. Javle, you talked about the ICRN. That's one of our major initiatives, very important. We have the batch trial coming up, and we're going to also increase fellowship awards on the clinical side. So multi-year awards and different things are coming. So we're so pleased to be here. We're so happy to be sponsoring this conference. We're so thankful for Lizong and Flavio for. It takes a lot of volunteer work. This is volunteer work, and so while we are volunteering on the advocacy side, and we have hundreds of volunteers who do this work, it is so important that we have your support and that you're here today and that we're working together. This is a global problem, and it can only be solved with global solutions. So we're so grateful to be here, and thank you. Appreciate it.
Any question from audience? Please, Choi.
Stacie, that's outstanding. Let me ask you a question regarding reconciling the needs of the patient's interests in complementary and alternative therapies with a lot of the how do you inform patients on these decisions? You know it's very important to patients, and yet, you know, the physicians perhaps may want to don't provide enough information on that.
Yeah, so there are a couple of things, and when my brother was, we looked at complementary things the entire time, and so we've always been very open to that. We do have an area on the discussion board, and there are some discussions in Facebook, and but this is an area that you should all just be aware that the patients are very interested in, and I know there's sometimes I think that's a conversation that, while you may not be supportive of that, unless there's data suggesting that should not be used, I think you should be a little more open-minded, would be my suggestion. Helen, do you want to say anything?
Not so much on the complementary and the alternative. I mean, I don't know. I was diagnosed 3 years ago, and I'm increasingly skeptical and cynical of anything without data also. But in terms of the repurposed drugs, I'm a huge supporter and consumer of. And I think there is increasing data. And when there's basically no harm done, if it can be added to somebody's regime, there shouldn't be so much opposition.
And so we saw some data at the conference from Lewis Roberts, right, on the aspirin. We've talked about metformin quite a bit. If you're not aware of this, the patients are aware, and they're talking about it all the time. And so I think what do you suggest, Mike?
I think this is a gap. Probably the majority of patients with advanced disease are exploring this area, are taking these therapies, and I think that there's a gap there. We are not well informed in that area, and at least we need to find ways to have those conversations. I don't know the answer, but this is a problem where I think advocacy can play an important role.
Yeah, I think the other area where we always see, and there was an excellent talk yesterday, was nutrition. The patients consistently ask what they can do in nutrition, and they're not getting good information from you. So we need, that's another area that we really have to have some focus on.
Yes, I'm the Dr. Okusaka from Japan, and thank you very much for your great talk. And I think the cholangiocarcinoma patient is so weak, and their prognosis is so poor. So in comparison with other cancers, so for example, the patient with breast cancer have strong enough to support them by themselves. So I think we need to establish the different supportive method for them. So could you let me ask to which activity we should do for them, and do you have any different activity in comparison with supportive care for breast cancer in your country?
Anyone like to take that on? What's the best supportive care? for cholangiocarcinoma patients in the U.S.? Is that what you're asking?
Not best support care, but any support, including the education or something like that.
You mean from an advocacy point of view? What's the best way that we support the patients?
Especially for cholangiocarcinoma.
It really depends on the patient, I think. Patty, feel free if you want to. And, we're talking to patients every day, and they all are looking for something a little different. But we do see, we see nutrition, a big need. I think the education piece is huge, too. They want to understand. And, so, we have a lot of patients who are research advocates, who are taking advanced training. I mean, they're not well. Melinda is a great example. She's a 9-year survivor and has had training through AACR and through RAN and through all kinds of things. They're very interested in understanding what's happening and helping each other. But other patients are not, are not interested in that. So go ahead, Patty.
Doctor, are you asking about the end of life? Like what is supportive at that point when you're talking about?
For example, the patient with breast cancer have joined their activity. But the patient with cholangiocarcinoma is so weak, and they have no time to join such activity.
Yeah.
So the one of the programs that the foundation has is this Cholangio Connect, where patients can talk to other patients, and they get support that way. Because in the population of patients that we have, some of them are very weak, but then there are others who are not. As most of us are familiar, they will eventually get there, or many of them do get there. Let me just say that. Many of them do progress that way. But they, for each other, they still want to think. Many of them, Melinda, who's not here, did a survey. They're willing to do more as far as be more aggressive with their treatment or with their testing. So I for many, even at the end, when most doctors will say there's nothing left for you, they want some bit of hope, even if it's just that tomorrow is going to be a better day. But it's the patients who help the patients. That seems to be, this support network seems to be the strongest thing that we have, and not just through Cholangio Connect, but they have like a Facebook warrior page, and those patients are on that every day, and they're checking to see if they are nauseous, what someone else might suggest for that. That probably is one of the strongest components for their support is the social connection.
Could I just ask quickly, are there advocacy groups for cholangiocarcinoma in Japan? Is there an advocacy group? I'm interested to know. I know that Thailand has two. Are there other? Let's see. Is Dong here from South Korea? I don't know if do you have? I'm just wondering if any of the Asian countries have advocacy groups, or they have. I'm not sure if you do or not.
PanCan Japan is also support patients with cholangiocarcinoma.
Okay. Anyone else?
So,
yeah.
Dr. Chen from Taiwan. So, I'm very interested in your congenital foundation. But I think there is a barrier for the language because my patient not so good at English. So, is it possible for your homepage or Facebook can translate to, for example, Thailand, Mandarin, or Japanese?
You can take anything off our website that you want, anything, and translate it.
Translate it.
Yours.
And through the Cholangio Connect program, we actually have volunteers. Some of them do speak Hindi. They speak Mandarin, Italian. There are individuals who
Spanish.
do speak multiple languages that are able to connect.
Nikoichi, Professor.
Okay, I'm Junji Furuse from Tokyo, and may I ask about the patient participation in clinical trials. We just start patient participation system in subcommittee in JCO study group. So, but seek how do we do and discussion. So we just heard United States patient participation system is already established. Do you have any experience of Cholangiocarcinoma Foundation to collaborate in clinical trial?
Yeah, we do this all the time, and we do that. We do it in a few ways. One is that we get patient-friendly clinical trial information out to the patients. So we put it on our website. It's housed on our website, and then we push that out through mailings, through social media, through all the social, Facebook, all those kinds of things. And we generally have had, I think most of the U.S. physicians here they've had very good accrual. So I think we're getting the information out. We're doing some targeted initiatives, Mutations Matter, and that's going to come out in the end of this month in Japanese, Mandarin, Korean, Spanish, Portuguese. So that information will be freely available to use with your patients too. But mostly that's how we do it. We just put the information out for the patients, and then we often survey the patients. And then I think the patients their connection with each other. They encourage each other to do clinical trials. I think I think clinical trials still have a bit of a stigma, but when they see patients like you saw on Patty who'd done 6 clinical trials, she was constantly telling people, who would be saying, oh, I don't know, I feel nervous about that. I don't know, is it, no. I've done 6 clinical, to hear from a patient who's done multiple clinical trials that a clinical trial this is your standard of care. If you're a cholangiocarcinoma patient, you're going to be on a clinical trial. Held a lot of weight with them. So.
Do you give us some comment on planning of clinical trial before
yes.
Start?
Yes, we work with industry quite a lot. Yes.
Okay, thank you.
Mm-hmm.